Did you know that many people have already had a heart attack and don't even know it? That's right. This is what's known as a silent heart attack. It's a heart attack that happens without the classic symptoms, without the typical signs. Want to know what the signs and symptoms are, how to diagnose it, and most importantly, how to prevent it so you never have a heart attack? So stick with me until the end of this video. I'm Dr. Alberto Ivo, a cardiologist, and the mission of this channel is to transform your life through knowledge. To start, I first need you to understand what the signs and symptoms of a typical heart attack are. It's a moderate to intense chest pain, located in the chest area, mainly on the left side, in the precordial region, and it feels like a tightness, right? It feels like someone is sitting, people usually say this, it feels like someone is sitting on your chest, or there's a burning sensation like your chest is on fire. The pain can radiate to the jaw and neck, to the inner part of the arm, and to the stomach area. It's usually accompanied by cold sweating, a sticky sweat, where the person feels cold, and nausea, which can even lead to vomiting. Depending on how the heart attack progresses, it can also develop into shortness of breath, okay? So these are the typical symptoms of a heart attack, which usually lead patients to seek out an emergency room, reach out to a family member, or call for emergency services. Now, let's go over the 6 signs that you might have had a heart attack and not even know it. The first signs are pains in unusual places, such as, for example, the entire neck, and not just the jaw area, the ear region, and the upper back area here, which really are regions that aren't usually associated with a typical heart attack. A second sign would be a feeling of indigestion. The person eats and the food just sits there. It feels like they ate a huge amount, even though they ate a normal portion. So that sensation could be a sign, of a silent heart attack. The third sign would be excessive sweating. Sweating more than usual. Not that cold, clammy, intense sweat you get with a typical heart attack, okay? But it's sweating when the person isn't usually someone who sweats a lot, And suddenly they're sweating way more than usual, even if the temperature hasn't gone up. So that's another symptom that's different from what they're used to. A fourth symptom would be dizziness or fainting. I once had a patient who was brought in by friends, by neighbors, to the cardiology emergency room. He had fainted in the street. And that was his only symptom of a heart attack. And on the EKG, we diagnosed it easily. It was an ST elevation heart attack, a heart attack that actually shows up on the EKG. And he even ended up having heart surgery because he was a very serious case. So why does this happen? It happens because during a heart attack, blood flow to the brain decreases, right? Because the heart isn't beating properly, either due to arrhythmia or just getting weaker, And this decreased blood flow can cause dizziness and even lead to fainting.
Hey, real quick, before we go on, leave a like and subscribe to the channel.
A fifth sign would be unexplained fatigue. You slept well, didn't do any strenuous activity, went to bed early, and still you've been feeling tired these past few days. That could actually be a sign of a silent heart attack, right? That's already a red flag, okay? So that's one more thing to watch out for, one more thing you should pay attention to. And the sixth and final sign would be chest pains that are more atypical and mild in intensity. Usually they're described as a tightness in the chest discomfort, okay? Nothing too intense, really. Doctor, I'm in a lot of pain, I need help. It's not like that, okay? These are pains that the patient often downplays, and usually doesn't seek medical attention. So who are the people most likely to have a silent heart attack? Well, first, diabetics, second, the elderly, third, women, and fourth, this is interesting, patients with a heart transplant. When the heart is transplanted, all the blood vessels are reconnected, but not the nerves. This means that when the patient has a heart attack, they don't feel pain. They'll feel other things, fatigue, discomfort, they might have arrhythmia, but they won't have the typical heart attack pain. Let's say you come to see me in my office and say, "Doctor, I watched your video on YouTube and realized I had some of those signs of a silent heart attack." Well, what tests do I have at my disposal to investigate this more clearly? First, the electrocardiogram, which is the oldest and most basic test, but it shows me a change we call a pathological Q wave, also known as a clinify of With that, you can more or less infer which region of the heart suffered the heart attack. A second test is the echocardiogram, which is the ultrasound of the heart, where we basically assess the movement of the heart wall, the heart muscle. If there's a region that's not moving, that area is probably the one that suffered the heart attack. A third test is myocardial perfusion scintigraphy. It's a test that's really used to assess perfusion, right? If there's an area that didn't take up the dye during the test, that's a region that's not being perfused. In other words, blood isn't reaching it. That suggests the person had a heart attack in that area. Other tests can also be used, like for example, magnetic resonance imaging, which will show me fibrosis, right? An area of scarring. Or catheterization, which is the best test to assess coronary artery disease, since it directly evaluates the arteries using contrast. And what are the consequences of a silent heart attack? Well, mainly arrhythmia, heart failure, and sudden death. That's right. People who have had a heart attack and don't know it, had a silent heart attack and aren't taking medication to prevent another event, have 3 times the risk of sudden death compared to the general population. And how can you prevent a silent heart attack? Well, I'll quickly tell you the 5 main pillars. First, lifestyle habits. Don't smoke, eat healthy, and exercise. Second, proper control of blood pressure levels. Third, control your blood sugar. No excuses, no whining, no candles, just control it. Fourth, manage your weight, keep your BMI below 25. And fifth, regular checkups with a cardiologist, especially if you have a family history of coronary disease, every 6 to 12 months. I hope you enjoyed the video. Leave a like, subscribe to the channel, help me out. Share this video with a friend or a family member. It could save a life. Big hug, and see you in the next video.
The doctor's great. Subscribe and like. Thumbs up for the treatment.